Fulcrum Care is delighted to introduce David Jones to Pivotal People. David is a partner at Deloitte and heads the healthcare team there. Welcome, David. Thank you so much for joining us here today.
Thank you.
What I want to do today is explore how you came to where you are right now.
Yeah.
So I understand you grew up in Ireland. Tell me a little bit about that.
Yeah, that's a long time ago.
Absolutely.
So I grew up in Ireland on a farm in the middle of Longford, so bang in the middle of Ireland. Went off to school, worked in Dublin, qualified as an accountant. So pretty much left home when I was 12.
Goodness, that was young.
It was young. It was boarding school. So those were the days when, the Irish left Ireland to go and conquer the world or do something else. So qualified as an accountant and decided to come to the UK. Mm-hmm. The plan was always to spend 2 years in Bristol and then go to London once I'd settled into the UK, but got sucked into Bristol life, great city, and now it's home outside London. So eventually when it was time to make that jump, again, young, kind of not sure what I wanted to do, sent my CV off to the recruiters, and I had done some work in care homes with a care home that was failing in Bristol, and got picked up by Michael Page, who said, we've got a small company looking to hire somebody who had a background in corporate finance. And I was initially resistant because probably, healthcare, do I want to get into healthcare? I want to get into tech. I want to get into something different. But after much toing and froing and did some interviews with Westminster, met Lord Carter, Pat Carter at the time, now Lord Carter of Coles, was convinced that was the move for me. Yeah. And that was very early days in the growth of the independent sector. That was 1997. Westminster were building purpose-built care homes, really high quality. The majority of homes are now in Barchester, but for the time they were leading edge, and that was great. But we'd raised some money on the markets. My boss, Andy Wilson, and myself were tasked with helping to diversify the business outside elderly care. So I suppose we were like kids in a candy shop. We said, what could we do that wasn't elderly care? I was left to continue managing some of the organic growth in terms of the development projects, which I really loved. But we also looked at mental health. We developed secure services. We invested into learning disabilities. We looked at home care. We were in diagnostics, basically looking through the whole market for where we could grow a much broader healthcare business, which was great. It was like being in the Google of healthcare.
Sure, I'm sure.
And that took us to early 2000s. The company suffered a share price issue. Basically, our secure services didn't fill as quickly as we forecast. We were at the vanguard of developing those services, so it was always ups and downs and issues like that. But our share price took a dip, and then Chuck took the company private.
Yeah. So going back to when you started at Westminster, do you remember the first time you entered a care home?
Yeah, I remember at the time not knowing the difference between residential care and nursing care. I was learning. Dementia was a whole new area. All the discussions around dementia design. Again, we were working with Stirling University. Contrast for the care homes, the carpets, the lighting, things now that which people say are, run of the mill.
Yeah, absolutely.
But then we were really thinking around design.
Yeah.
And some of the design we put in now, you'd go, that was nuts. But we were, again, pushing the boundaries. Those days when you had to go out and approve capital expenditure, and luckily a business like Westminster in those days was very forward thinking. So building an extension or building a new reception area, when the return was probably not fantastic, but it improved the longevity of the home.
Of course.
It gave it a new market. It opened it up. So it was kind of understanding the softer side with the financial side. So it isn't always the pounds, shillings and pence. And that I really enjoy.
And I think that's something that the care sector is starting to evolve into understanding the business a lot better. Certainly the care home managers back in the day were care managers and now business managers and have to be business managers to do the job. Going forward then, your contact with those sort of care home managers, the people on the ground, did you actually have that contact with them while you were working for the company?
I mean, we, part of the job was to get out and look at, if we were developing a new site, a new care home, look at it, look at the site, look at the plans, work with the architects. I really enjoyed that organic growth. Yeah. And then once something was up, running, established, it was, if you want to build an extension on it, does it make sense? So you were always getting out and talking to the team on the ground. It was a busy organisation. It was, it was everything you did had to have a kind of purpose with what you were doing.
So the next stage of your career from Westminster, where did you?
So John Patel took the company private with backing from Goldman Sachs and Welsh Carson, and that was it was like joining a new organisation. Very different focus. We had assembled a lot of businesses that weren't working, so there was a certain amount of divestment of businesses. We sold our diagnostics division. We bought Priory Group from Deloitte, where I ended up, and brought Priory in, which then created a much broader mental health business. So we ended up with two businesses, one which was a care home division and one which is focused on specialist health and mental health. And spent another 2 years there, and then joined Deloitte and worked on the management buyout of the elderly care division to create Westminster Healthcare backed by 3i. And again, at that stage, the business was broken in two. Chai did a management buyout to take Priory, and Tony Hayward and Tim Street and colleagues took the care home business with backing from 3i that direction. So, and it was great to be involved in those transactions.
Yeah. So up to present day. So you've been with Deloitte for over 23 years.
Just over 23 years. Yeah, that's a long time.
Yeah. And how has your career developed within that organisation?
I think in the early days, I was very lucky. I joined a large organisation that was just starting to think about sectors. I mean, everybody knew how to do a deal, how to buy something, sell something, but clients were asking for sector focus. Particularly the private equity community, who were very interested in investing into health and social care. And I had a background in health and social care, lucky me. So I suppose I was employee number one, joining just at the time that private equity and other organisations were seeking to invest into the healthcare sector. So we worked with, all the great private equity funds that are out there that have worked in the sector over the years. So I was doing transactions, either selling to a private equity fund or selling for a private equity fund, and generally raising capital to help the growth of the sector, from the early 2000s to where we are today. But that was building a team. It was broadening our expertise now into everything from medtech to life sciences, health and social care, and a much broader range of transactions. Exciting to be involved in the evolution of what is today. People, think is a quite a mature sector, but
Absolutely.
It's changed a lot. Back then, local authority fees and private fees were broadly the same. Now there's a big gap in funding. I think it's much harder. Staffing is harder.
Yeah.
It's a health and social care has continued to be underfunded, and over the last 20 years, you've seen that squeeze continue. So, and that's disappointing. I think as a result, operators have had to get smarter.
Yeah.
So we've seen the arrival of technology, and it's become, operators have become more sophisticated. It's no longer the domain of the mom and pop. It's been good to work, but also to see people push the boundaries. The size of care homes has increased, the size of bedrooms, the arrival of retirement villages, or that model, what is the model going forward? Private pay care homes now have competition from the private pay domiciliary market and live in. So, but I wonder if we can't look at some of the models that have developed in different geographies and, with a bit of help from government, how do we develop assisted living, how do we deal with the housing stock and get people to feel comfortable moving out of the 5-bedroom house into some sort of retirement living concept.
Yeah.
We need, I think, support from government around planning and funding and a much longer term strategy for health and social care. And obviously the division between the NHS and social care is still there, but how does that become a lot closer and tighter?
Yeah, I understand that totally. I've been in care as long as you have, maybe a little bit
longer maybe.
And I think, you worry about the future, certainly with staffing and with the stock of care homes we've got out there. And you're right, we need to be thinking about what's going to happen in the future. So going on from that, if you, in the future, had to choose your own care home, how would you go about doing that?
It's acceptable to make a fair margin, a fair return. And I think sometimes people focus on very short-term trying to make a return in a very short period of time and squeeze the model, and that doesn't really work. I think you've got to be looking at this utility long-term. I'm building something that I want to be fit for purpose in 25, 30 years. And yes, that means you take a lower return because you build better spec, you invest into your staff more, but it gives you longevity. And if you invest into your staff, you get reduced agency and reduced staff turnover. So it can be self-funding, an awful lot of this. Yeah,
it can. So I think the future of care, from your point of view, is there forever, as you've said. So what can we do within the sector to improve things?
The biggest changes will actually come from what the sector can do with government and how we find a different way to provide. Because at the moment we've been doing the same thing for since I've come into care. So, the thresholds haven't changed. We've got now 60% of the market is private pay. So we've got a stealth tax effectively evolving there. Where people with funds pay for care and others who can't afford it get a very poor quality service. So that needs fixing. And I think working with government to think about that, but also think about, what can we do with planning to release land or zone land, whether it's for a new product in retirement villages or for its care homes. Can we think about supply demand in a more constructive, structured fashion rather than let's just put lots of care homes in that locality because that seems to give a good return today. But are we looking at what might happen over the next 25 years, 30 years?
So just tell me about a few of those transactions that have stood out for you over the years that you've been doing the job you're doing.
Wow. There's been quite a few.
Sure.
There's been quite a few. And I've always been interested in the development of new ideas, pushing the boundaries and those businesses which are coming up with. And so I worked with the Christie NHS Trust when it joint ventured with HCA. So that was the NHS joint venturing with the independent sector to roll out cancer services. Again, fantastic. The first time HCA had gone outside London, the Christie being a really strong provider of oncology services, trying to find a partner to really turbocharge what they were doing. So that was really great. That was great innovation. Working with businesses like Exemplar, dealing with that part of the market that was badly served, people with, challenging behaviour with a nursing need. By and large, they were being served by care homes that didn't really know how to deal with those individuals. Taking that business, which was privately owned, working with a private equity fund, Agilitas, to really grow that business. And then, it moved on to areas today. So again, taking that part of the market which was underserved and developing a service around that. And I did a stint in the Department of Health at the very start of the COVID program, working on the rollout of care home testing. Probably the hardest 3 months of my life in terms of working. It was the way the sector pulled together.
Absolutely.
Was just unreal. Really, working with the care homes to try and work out how we tested. Working with parts of government to get things through and get things, CQC, and just trying to, fix a problem which nobody had the solution for or the playbook for. So, that was really enjoyable. So, I'm very lucky to sit in a position where I can work across the sector.
Okay, that's been really interesting. Thank you very much.
Thank you.
Thank you.